Hi, my name is Rachel Greenberg, and today I'll be talking about pancreatic cancer, the different types of treatment you can get, and the surgery called the Whipple procedure. So, pancreatic cancer is known as the silent killer because its symptoms do not show until it reaches a really late stage. At that stage, it is almost impossible to survive more than a year with the diagnosis, and from then on you can use two different types of surgeries to improve life quality. The potentially curative surgery is used to potentially cure the patient or remove all tumors from the body, making the patient cancer-free or tumor-free. Or the palliative surgery, which is used just to improve life quality or to prolong the life by a few months or maybe a few years by removing portions of the tumor but not the entire tumor. An example of a palliative surgery would be the Whipple procedure, which is actually the most common procedure as of today. So pancreatic cancer is known as the silent killer because the cancer and the tumors do not show symptoms until the pancreatic cancer has reached stage 4. And at stage 4, the cancer has either taken over the entire pancreas or spread to other organs, surrounding organs like the liver, the gallbladder, the stomach, and in rare cases it moves to the lymph nodes and to the lungs. And in that case, it's virtually impossible to cure or remove all of the tumors. But it's very, very hard to survive pancreatic cancer. 74% of people die within the first 6 months to a year, which is an unfortunate number, and 8%, only 8% live beyond 5 years with the diagnosis, which is just a very, very low rate, which is really sad. But there's two ways to go about treating the cancer. There's the potentially curative surgery, which is less common because you have to have like a stage 1 or 2 cancer that's only contained within the pancreas. And with the potentially curative surgery, surgeons are able to completely remove all of the tumors or most of the tumors, making the patient cancer-free or tumor-free. If they have gone beyond those stages, palliative surgery would be the best way to go. Along with palliative surgery, one can receive chemotherapy or radiation therapy because the palliative surgery doesn't remove the entire tumor. It only removes the strongest parts or portions of it to improve life quality or to reduce pain. An example of the palliative surgery would be the Whipple procedure. In the Whipple procedure, an incision is made down the front of the patient or ventral of the patient, and in the Whipple procedure, the pancreas and tumors or pancreatic tumors are removed, but along with that, there's a lot of rearranging of organs. Some organs are taken out, some are transplanted if it's become that big of a tumor, or if the tumor or cancer has spread to that many organs. It's the most common because palliative surgeries in general are the most common because most people are diagnosed by the time they're already at stage 4. So that would be the most common type of surgery. And then the Whipple procedure, which is falls under the category of the palliative surgery, is the most common because it just is the most effective way to get to the pancreas instead of going from the back or any other part of the body. And the Whipple procedure just remains to be the most effective procedure that we've seen today, and pancreatic cancer remains to be one of the deadliest cancers known to man. Thank you very much for watching, and see you next time.